May I start, or somebody gonna give a introduction talk?
Just a minute, Sensei. We'll just give an
Okay.
introduction and then you can start.
Okay, thank you.
Yes.
Camera. Hello. Yeah, good afternoon to all and good morning to Professor Henda and good evening, Atsuko. Can you hear me?
Yes, I can hear you.
Okay. Yes. So just wait for 1 or 2 minutes. Some more people will join because this is a lunchtime for in India. So we'll just wait for 2 minutes and then we'll start.
Yes, thank you.
Yeah, there's some... Yes. Light is there so that. Can we share the slide for AQML site? It's already there. Okay. Hello, good afternoon to all of you, and very good morning. And I welcome Professor Atsuko Ikeda to to this air quality management lecture series. All the participants. Um, this is our 58th air quality management lecture. We started this lecture in October 2020. It's one of the forum for young researchers, scientists, engineers, and educators and practitioners to share the latest advancement and some theories, applications related to air quality management. So this is a lecture being given by various experts. They in turn cover various experience they gained to share their knowledges with young researchers on any topic related to indoor and outdoor air quality management. It also provides platform for collaboration with stakeholders and experts. So we started this lecture in October 2020, and these are all our speakers in the past. You can see that the eminent speakers from across the globe, they talked on this. Today we have with us Dr. Ediko. Atsuko is here. So we also like to say that Air Quality Management Association also been created in order to promote air quality related activities within the society. We also, collaborating this activity with CEPHA network, which is the UKRI sponsored project, and this is a more than 10 institutions are involved across Asia in promoting clean environment in planetary health in Asia. So we also have Indian International Conference on Air Quality Management. So that will going to happen in December 15th to 19th at IIT Delhi. And those who are interested, please join us for this event. So today we'll have air quality management lecture series. The talk will be on indoor environmental quality and health studies in Japan. Atsuko Ikeda will going to talk about this, and I request Chaitra to introduce the speaker.
Yes, sir. Dr. Atsuko Ikeda is a faculty of health sciences, jointly appointed with the Center for Environmental and Health Sciences and the One Health Research Center at Hokkaido University. She earned her doctoral degree from the Department of Public Health Sciences at Hokkaido University Graduate School of Medicine, and she had been working at HU Center for Environment and Health Sciences for over a decade. Her research primarily focuses on environmental endocrine disrupting chemicals such as phthalates, organophosphate flame retardants, and per and polyfluoroalkyl substances and their impacts on children's health, including asthma, allergies, puberty, and reproductive hormone development. She plays a key role in the Hokkaido Birth Cohort Study on Environment and Children's Health, one of Japan's prominent cohort studies investigating environmental impacts on child development. In addition to her research on children's health, Dr. Ikeda is deeply engaged in studying the broader indoor environmental quality and its influence on the health of residents. Dr. Ikeda's work also extends internationally through her collaboration with the World Health Organization. As Hokkaido University CEHS is designated a WHO Collaborating Center for Environmental Health and Prevention of Chemical Hazards, she actively works with the WHO Collaborating Center in Vietnam, conducting health examinations of workers in e-waste recycling villages. Today, she is giving a talk on indoor environmental quality and health studies in Japan. It's a great pleasure for having you as a speaker for her 58th Air Quality Management Lecture Series, ma'am. We welcome you, and please share your screen for starting your presentation.
Thank you very much for your kind introduction. And I also want to thank Professor Shiba for these great opportunities. So I'm Atsuko Ikeda from Hokkaido University. And let me please share my slide first. Can you see my slide?
Yes, it's clear.
Okay,
Yes.
okay. Thank you very much. So today I'd like to introduce some of our studies done in Japan. So today's my topic is into environmental quality and health studies in Japan. And this is the contents of the presentation today. So first of all, I'm very honored to be here from Japan. And I'm afraid that the housing environment could be slightly different from India or other world. So I tried to introduce some of photos from Japan. So this is not the indoor, it's actually outdoor. It's a very beautiful cherry blossom we have inside our university. So whenever you come to Sapporo, you can enjoy these cherry blossoms in our campus. Anyway, I believe that all of you know the importance of indoor air quality because we humans spend more than almost like 90%, especially in highly developed country, we spend around like 90% of our time indoors. And in terms of the chemicals, the daily intake of chemicals from environment, the home environment grade have a higher involvement. So about 60% of our chemicals are what emitted from home environment. So indoor air quality can be influenced by many different factors. I also believe that you already know these kind of issues, but outdoor air pollution, of course, matter a lot, like vehicles and industrial plants. So if the outdoor air pollution, if you have an outdoor air pollution, it's quite difficult to maintain clean air indoors. And also what kind of fuels you use for heating and cooking is a big issue. And of course, if there's anyone who smoke, a second-hand smoke can be a big issue. And if you have a poor ventilation system indoors, there could be the indoor air can be contaminated. And if you have overcrowded homes and insufficient living space, this can be matter, especially in terms of infectious diseases. So today I'm not going to talk about the infectious diseases, but it's overcrowded is a very big issue. Also, customs, habit, traditions, and meteorological conditions matter, influence the indoor air quality. And levels of economic development, such as industrialized country and developing country, have a different indoor environmental issues. In terms of poor indoor environment in global, the poor indoor environment can be happen more in lower and middle income countries. So this is the report from WHO. So if you have a coal and biomass fuel, those can be a major source of household indoor air pollution. And coal and biomass burning could suspended particle matter increase and risk of acute respiratory infections. And monoxide carbonate and other toxic gases may also impair development and health among those houses who use the poor burning system. And unfortunately, like more than 53,000 children death from household air pollution younger than 5 years old. This is quite old information, more than 10 years ago, and I believe that its situation can be improved since then, but still there's a quite big issues, I believe. On the other hand, in developed countries, maybe the biomass marking are no more issues, but air tightness of the building has been increased in Europe since 1970s, resulted in an increase in health problem caused by poor indoor air quality. So this is termed sick building syndrome, abbreviated as SPS. In 1990s, some people in newly built or renovated houses reported a variety of non-specific subjective symptoms resembling SPS in Japan. And we call that sick house syndrome, SHS, because it's happened mainly in dwellings. So in these cases, formaldehyde and volatile organic compounds, VOCs, emitted from building materials were defined as the major source of SHS in Japan. After this incident or accident, Japanese government took two measures. One is a regulation of chemical emissions, and two is mandatory of ventilation systems. So the Japanese took an issue in 2003. So we changed the governmental law. So since then, the number of consumer compliant related to sick house syndrome has been dramatically dropped. However, as you see, it's dropped dramatically since 2003, but still remained in certain levels. So this means we still have some compliance about the sick building or sick house syndrome every year. So those who are not familiar with sick building syndrome or sick house syndrome, this slide shows the typical symptoms. So the symptom itself is very general, like eye irritation or like rhinitis, blocked nose and sneezing, itchy, dry or flushed and erupted skin, hoarseness or dry throat, coughing and wheezing, and sometimes fatigue, feeling heavy-headed, headache, nausea, dizziness, and having difficulty concentrations. You may think these are all very general symptoms. So even if you get cold or like COVID, you may feel this kind of symptoms. But the point is here in specific buildings. So if you have these kind of symptoms in specific buildings, and when you relieve these symptoms, when you leave such a space, then we can define that symptom is related to buildings. So the symptoms caused by the building itself can be considered as a sick building syndrome. So let's take a look more deeply about the environment, indoor environment. First, I would like to start from the chemicals. As I mentioned before, after the sick house syndrome issued, Japanese government give guidelines, indoor air quality guideline values for chemical substances. So it started from formaldehyde and chlorpyrifos, one of the insecticide. But now we have these like 14 different kind of chemicals. So when we build a new house or when we renovated the house, we need to measure the house indoor chemical levels, and the chemical levels need to be lower than these guidelines. And these guidelines are set even if we spend our time for our whole life long, it won't affect our health. So what are these chemicals? So the main chemicals associated with the sick house syndrome is a formaldehyde, and in Japan, SHS started from these chemicals. So formaldehyde causes irritation in eyes and noses, and it's carcinogenic to humans, defined from IARC. And guidelines has been defined by WHO, maximum value for 30 minutes average expire, not to expire 0.1 milligram per cubic meter. And it's the same value, but Japan National Institute of Health Sciences also defined the guideline levels as 0.1 milligram. It's same as 100 micrograms per cubic meter, which is equivalent to 0.08 ppm. And to reduce the emission risks, emission of the formaldehyde in indoor materials, Japan also have a 4-star signs which GIS or just can mark for low emission of, the Japanese just put 4 stars when the formaldehyde emission rate is very low. So we can use only 4-star materials in indoor materials. And other other VOC there are many VOCs, so we can define the VOC by boiling point. So if the boiling point is low, the chemicals can be defined as a very volatile organic compound. But VOC fall into the boiling point between 60 to 290. And there's other category, SVOC, semi-volatile organic compound. I will talk about SVOC a bit later, but SVOC have a higher volatile organic, higher volatile temperature. So SVOC mainly exists in household as a dust or particles. This slide shows the possible source of indoor pollutant. So chemicals can be emitted from many different places. So originally, of course, the housing materials, but also like air freshener, like this accident in Korea, they use the VOCs, or like housekeeping materials can cause a mold or bacteria. And also like bathroom, we have a dampness or moldy odor, which also emit some chemicals. And rodent and bacteria, so they can be the allergen, or smoking can be the indoor pollutant source. So when we conducted a home survey, we visited homes. So these are 2 master course students I work together. So we drive our car and visited homes. And these are the passive samplers to collect formaldehyde and VOCs. So we set these samplers in household for 24 hours and calculated the concentration of formaldehyde and VOC in indoors. So initially, we visited more than 400 relatively new houses in all over Japan. So these are the chemicals have a guideline in Japan. And fortunately, the chemical levels is much lower than guideline levels. However, we found some households exceed the guideline values in Japan. So among 425, 3.5% and 12% and 5.6% houses excess these guideline levels of the formaldehyde, acetaldehyde, and paradichlorobenzene in total VOC respectively. So even the house were built after like 5 or 6 years, 5 or 6 years after the house was built, there was still some emission of these chemicals. Then we tried to examine the associations between the formaldehyde levels in indoor air and SBS symptoms. So we divided the formaldehyde levels in quartiles, which means quartile 1 have a lowest formaldehyde levels and used as a reference. So when we compare the houses with low formaldehyde and prevalence of sick building syndrome, when the formaldehyde levels increase to Q2, Q3, or quartile 4, which is the highest formaldehyde levels, the SBS symptoms increase for about double. So which means even most of the houses have a lower formaldehyde level than guidelines. If the house have a higher levels of formaldehyde, you might have a higher chance to have a sick building syndrome prevalence. So we recommend each houses to keep these chemicals levels as low as you can. So we visited the same houses for 3 consecutive years. So as you see in this slide, indoor concentration of formaldehyde, acetone, and toluene decrease every year. So this slide suggests or implicate that the chemicals emitted from the indoor building materials can be reduced day after day. So after every year, the exposure level can be decreased. Interestingly, here, one chemical called limonene increase every year. So what is limonene? So limonene is a chemical mainly emitted from wood materials. So wooden houses have a higher levels of limonene. And in addition to housing materials, we put limonene in many consumer products, such as detergent, housing cleaning materials, and others. So these limonene might come from the consuming habit. So the inhabitant buys some product in grocery or drug stores, and they bring in these chemicals. So the emitting source of the limonene can be the habit of the inhabitant. So we also need to consider about the chemicals which inhabitants bring in. So nothing to do with the housing materials. So next, I would like to inform about the semi-volatile organic compounds, which are plasticizer and flame retardants. So phthalate and phosphate flame retardants are a class of chemicals predominantly used as additives, as plasticizers and flame retardants. So these has been used in housing materials and consumer products, so they can be found in indoor dust. So association between phthalate, ester, and allergens has been reported, but studies about the PFR were limited. So when we visited the house, we collect the house dust from floor and somewhere above 35 centimeters. We call that multi-surface. So we collect the house dust from floor and multi-surface to examine if there's any such SPOC can be found or not. So when we analyze the house dust, we found the DEHP, which is a major phthalate we use in PVC floor material houses. So I don't know if maybe this kind of floor material can be varied between countries or type of the housing. But in Japan, many recent houses have a compressed wood floor or like wall-to-wall carpet. Maybe this is quite popular in Western and Europe countries. And some houses have a very traditional tatami floor, natural tatami floor. But when the house have a PVC floor materials, the levels of DEHP in house dust is significantly higher compared to other type of flooring, suggesting that DEHP emitting source is definitely a PVC floor materials. In Japan, PVC is not only used in floor, but it can be also used in wall or ceiling covering materials. So in many houses in Japan, we use a cloth paper, which is not made by paper, but actually made by PVC. So we compare the phthalate levels in house dust between the houses have a PVC materials only on one area or no area, or one or two or three areas. So 3 areas mean the houses or rooms. Rooms are surrounded by PVC materials, all of floor, wall, and ceiling. And we found a significant higher levels of DEHP in floor dust when the room was surrounded by PVC materials compared to rooms without areas using the PVCs. So these results also suggest that the DEHP found in house dust emission source can be the indoor materials or indoor interior materials. Next, we try to find the association between house dust phthalates and allergies among inhabitants. So these are type of the chemicals of phthalates, and we divided the levels of phthalates in house dust into tertiles. So you see in y-axis, first tertile is the houses with the lowest contamination of DEHP. And here's the second, and here's the third with the highest contaminated DEHP houses in floor house dust. When you compare the allergic conjunctivitis prevalence with the houses with the low DEHP in house dust, when the chemical levels increase in house dust, the allergic conjunctivitis prevalence increase. And red circle is the children, and adult circle is the blue circle is adult. So we found quite clear association between the house dust levels of DEHP and prevalence of allergic conjunctivitis, allergic rhinitis, and atopic dermatitis, especially among children. In another word, high levels of DHP, DINP, PVZP, and DIBP in floor dust increase odds ratio of allergies. And we see the clear dose response relationship, especially among children. Interestingly, multi-surface dust didn't show any significant associations when we are more exposed to floor dust, but not from multi-surface dust, which exists in higher place. But still, you may have a question. We are not eating dust. So we have examined the association between house dust and urinary metabolite of these chemicals. So we collected the house dust and children's urine samples at the same household. And we measured the house dust concentration of the parent compound and metabolite levels in urine samples. And here, the correlation coefficient. And as you see, there's significant low but significant correlation between concentration in house dust and urinary metabolite. Especially this concentration correlation can be found in floor dust, but not so clear in multi-surface dust, which also suggests that we might expose to floor dust, but not so much from the multi-surface dust. Maybe similar in India, but in Japan, we take off our shoes and walk barefoot indoors, and all children play around in floor. So children might be exposed, ingest this house dust and at the same time exposed to these chemicals. We also tried to find the association between the urinary metabolite and asthma and allergies. So this is the findings of urinary metabolites. So the phthalates, this is the name of the chemicals. And if the metabolite levels is higher in children's urine, children may have a higher chance to have wheeze or eczema. And moreover, in our housing materials or consumer product, there's multiple chemicals are used. So we used a combined exposure of these phthalates, and this a mixture of phthalates model. So x-axis is a higher mixture of the phthalates, and we found that increase of the eczema prevalence. So which means not only single chemicals, but multi-chemicals exposure may increase a risk of having wheeze or eczema. We also examined the phosphate flame retardants and asthma and allergies. So upper part is a single chemical models. So if the higher TDCIPP, there might be a higher risk of having wheeze. And if we have a higher levels of TDCIPP, TPHP, or TBOEP in urinary metabolites, you may have a higher risk of having high FeNO, which is a airway inflammation. So FeNO and wheeze are highly connected, and also high levels of eosinophil. So FeNO and eosinophil is sort of subjective marker of asthma and allergies. Objective marker of asthma and allergies. So here's a brief summary that if you use a housing materials contain phthalates and phosphate flame retardants, indoor dust level become higher, and children could be exposed to those chemicals, which increase wheeze as a phenotype of the allergies, and at the same time, it may increase the subjective marker of FeNO, eosinophil, neutrophil, which is a marker of asthma and allergies. So next, I would like to move to the ventilation and dampness. So Japanese government, when we have a sick house syndrome issues, the first major is a reduction of the chemicals. Second major is the ventilation. So this is the Building Standard Act of Japan. So it was renewed in 2003. All living spaces in Japan are required to have a 24-hour ventilation system, ensuring an air exchange rate of at least 0.5 times per hour, which means half of the room's air must be replaced with fresh air every hour. I would like to show a little some picture of Japanese houses. So actually, I grown up in very, very old Japanese style house. It's very old house. So old house are made of wood and like papers. So the air tightness was very, very low. So almost all air can be just airflow rate is very high and very low air tightness. So it was okay. We didn't have to worry about the ventilation in previous houses. But in Japan, modern houses, we have, this is my brother's house, but the modern Japanese house have a high air tightness, especially after renew of the government, guidelines and Japanese law. All house have a high air tightness, so they need a mechanical ventilation systems to change the airflow. And also, this is a photo of Sapporo in winter time. So in winter, we have many snowfalls and temperature dropped below minus. So to keep out the cold air and keep our indoor warm, we need a high air tightness. So in such a high air tightness houses, usage of the ventilation is very important. So as I mentioned, we have a Japanese law, and this is a comparison between houses using ventilation system and housing without ventilation system, or even if they have a ventilation system, they stopped. So here, bottom part are name of the chemicals. So it's quite obvious that if we do not use the ventilation, indoor chemical levels increase. So definitely ventilation system is must items in modern houses in Japan. So air tightness in Sapporo, as I mentioned, it's very cold in wintertime. So this is my house, my apartment. So we have a double windows with double glasses. So it means we have triple glasses to avoid the cold air. But even in Sapporo, if we do not have a suitable ventilation system, it is not only a chemical issue, but it also causes a dampness and mold growth. So these in the houses, I got the picture from my colleagues. So when they crush the old houses, they have an insulation between the walls, and those insulation have a mold growth. So this we call dampness. So excess humid cause this kind of dampness in indoors, and it increase. It is a very big issue in Japan. Same time, I will show you a result of the stove later. So I want to introduce one photo. So in Japan, in Sapporo, because we have a very cold winter, we have a big stoves with the exhaust vent. So if we have an exhaust vent, when we burn a coal, or not coal, but fuel, all particles or NOx, SOx, and those kind of particles go outside. But if we use the portable stoves without exhaust vent, all emissions of the burning can pollute the indoor air. So let's take a look at some of the dampness issues. So we asked the household if they have a dampness. So indicator of the dampness can be the condensation, mold, moldy odor, or hardly dry wet towels in the bathroom, and water leakage. And without those dampness compliant is a reference. So when we have a sick building syndrome in houses without any of these symptoms, and is a reference, and compare the houses with 1, 2, 3, or 4, or 5 of these compliant. If you're compliant, I mean the indicator of the dampness increase, those households may have a higher chance to have a prevalence of sick building syndromes. So dampness is a very big issue you have to avoid. So what causes dampness is a high relative humidity and inadequate ventilation. So again, the ventilation system is very important in modern houses. So here's another result from the Sapporo school children's survey. So lower part is the dampness. So when the houses have a moldy growth or moldy odor or condensation, the houses might have a higher risk of having children suffering from atopic eczema. So the odds ratio, the risk can be between 1.2 to 1.5 higher when the house comply about the moldy growth or moldy odor or condensation. And in addition to sign of dampness, above part is the stove usage. So compare to electric heater, which we consider as a clean energy, the houses use stoves without exhaust vent. The houses have a higher chance to have children comply about the atopic eczema. Of course, this is a cross-sectional study, so we cannot exactly say the causal relationship. But of course, the children with eczema do not prefer to live in stoves without exhaust vent. So we think that this is the cause and this is the outcomes. So similar to atopic eczema, this is the findings of asthma or wheeze. So compared to electric heater, clean energy houses, if the children living in houses without exhaust vent, without ventilation, the risk of having asthma increased up to 3 times higher. So definitely using clean energy, or at least having an exhaust vent and having a ventilation is very important to reduce the risk of having wheeze or asthma. So here's the last part, how to reduce indoor pollutant. So here's some approaches to reduce household indoor air pollutions. Of course, the most important thing is eliminate or control the source of pollution. So we need to improve stoves, use clean fuels, and use venting stoves or cooking and heating. But not only having those systems, but we need a regular maintenance of cooking, heating, and cooling system. And we have to choose non-volatile, non-toxic building materials. And we try to maintain dry homes and schools to reduce the dampness. But even if it is difficult to eliminate or control the source of pollution, we can use the ventilation. But at the same time, ventilation is somewhat difficult to control after building has been built. So this part, we need to collaborate deeply with the building engineering and building design. So it's very important to collaborate with the engineering part. But ventilation is very important and very useful to dilute and remove pollutants through ventilation with outdoors. But on the other hand, I'm afraid the outdoor issues in India or other parts of the countries. So if you have a ambient air pollution, maybe the things become even more difficult because of ventilation. I mean, the introduction of the ambient air increase the indoor pollution. So maybe you need a filtration system. We need to use a high filter when you take in the outdoor air to the indoor to reduce the ambient air pollutions. And we also need the air cleaning, so which is a third approaches, but not air fresheners. So air filters and ionizer may remove some airborne particles. And gas airborne materials are used to remove gaseous contaminant. And of course, HVAC system and good filtering system, air cleaning is very important and is effective to reduce the indoor pollution. So this is a take-off message from today's presentation. So I'd like to recommend you to use the ventilation system, but if ambient air is clean. If it's not, maybe we need to think another way. And do not bring unnecessary chemicals, especially consumer products. And please avoid condensation and mold growth. And also clean to reduce house dust, to reduce the SVOC. And this is some of the cartoons we try to improve you can find house dust and clean how you can clean your house. And please introduce one book we edited a few years ago with Dan Novak from Norway and Eiko Kishi from Hokkaido study. So if you are interested in today's talk, please take a look at this book as well. And this last my slide, I'd like to thank all my colleagues and students, and I'd like to acknowledge all participants, collaborators, and grant agencies. So thank you very much, and I'm happy to take your questions.
Yeah. Thank you very much, Atsuko, for a wonderful talk. It was very useful. So before that, I just like to know, as you see that the climatic conditions in Japan and India, particularly in the Asian countries, so we have quite a good challenge particularly in Asian countries. Biomass is still a major issue, particularly in the rural environment. So there are some technologies they have worked out, say for example, improved chulas, where cooking can be made effective with effective burning of all the firewoods. But still, as you rightly said, the ventilation is a major challenge because in the rural areas, the ventilation still is a challenge. So, do you have some solution because if they have to redesign the whole house, it's quite challenging because economics may not able to help them. So, in such cases, how do we improve the ventilation aspect?
Yeah, maybe one is I'm sorry, I never been to India, so I never really see your houses. So I just talking from my images or photos I do have, but I understand that maybe if you have windows, so maybe when you do the cooking, you can think of the household airflow. So open like two house, if you have some open like window or doors, if you can open, then it may help to emit some of the particles. But other parts, I think it might be quite difficult and challenges. So introduction of the clean energy, I mean, at least like a gases can be the another another issue. I mean, the next step you need to think of.
Are there any government initiatives in reducing or addressing this indoor air pollution in Japan?
Actually in these days, no house use a biomass burning except purposely like a barbecue or anything.
Okay.
So it's a bit difficult to give you a good recommendation. I'm very sorry about that. But I use one book, the LSA book, and within that book we have asked one colleague from Sri Lanka, and he wrote about the biomass burning topics. So maybe his suggestion can be helpful.
Okay. Yeah, so I'm just trying to look at it. Are there any standards in Japan for indoor air quality management?
Yes, so that's first one part is the chemicals. So when we build the new houses, we need to reduce the chemical levels at certain levels. And nowadays, we need to install a ventilation system in all houses to have to replace the household, I mean the air. Half of the, yes, so we do have guidelines and management. And in Japan, there's of not only the guideline for chemicals, but also like CO2s. And we have quite a lot of different management system and guidelines.
Okay, thank you. There are some questions in the chat box. Were you able to see them? Then otherwise I'll read it. Click on the chart, you will see the questions.
Yeah. Okay, yeah, thank you very much. So it looks like solution to interpollution lies in well-ventilated housing use of appropriate materials in contrast as well as in furnishing. Architects and interior designer need to be mandated in this direction. Thank you very much for SK and Viral Tech. Yeah, I agree with you. So we need to close collaboration with the architect and designers. Thank you very much. And the studies on sick house syndrome in Japan have shown that poor ventilation dump into a condition and emissions from building materials like VOC are like to respiratory and allergic symptoms in children. Considering a widespread use of plastic-based product in indoor spaces, especially in airtightness homes, is indoor plastic pollution also being observed or studied in Japan? Oh, this is a very good question. And actually, it's my great interest. So the airborne microplastic in indoor is very limited. So now I try to do some studies with my students and maybe hopefully with Aswin in my future to measure the microplastics in indoors. And do you think airborne microplastic could be a hidden factor contributing to similar health issues like asthma, wheezing, or eczema in children? Yes, it can be. The difficult part is microplastic is the combination of physical particles and chemicals emitted. So microplastic itself is like a PM 2.5. It's a physical. So it's a physically, it can be affect our health, especially maybe respiratory symptoms. And at the same time, where those microplastics come from can be the PVC, can be, so if the PVC materials degrade and become a microplastic, it's also an issue of SVOC, like phthalates. So we need to think about both sides, chemicals and particles itself. So it can be very challenging to separate or how we can do the exposure assessment. We still, there are still lots of challenges, but I think definitely agree this is my interest and new challenges, and that definitely we need to solve. And thank you, Aswin. Thank you for presentation, Professor. One, the multi-surface settle dust may vary based on cleaning frequency, occupancy, indoor activities, etc. Could you please explain how it was normalized, adjusted? Thank you very much. Yes, definitely it can be affected by how often you clean the houses. In general, in our study, we use the exposure exposure measurement as a microgram per gram house dust. So we use house dust per gram house dust as to standardize the levels of the polluted dust. But at the same time, I agree that if you clean the house frequently, maybe the house dust become cleaner, so the phthalates levels become lesser. So we also asked how often you clean the house. So that can be not the normalization, but maybe if you ask about the frequency of cleaning, you can give a solution like, okay, you can clean the house frequency, which can reduce the chemical levels in house dust. So it's rather not the normalization, but for to give a guideline or give a measures. I think it's very important to know about the frequency, occupancy, and indoor activities. And second question, is there any recommended cleaning frequency to reduce exposure to settled house dust in Japan? It's not the guidelines or anything, but we asked the household how often you clean your floor. And actually, we found the association that if you clean your house more than, if you clean the house within 3 days and more than 3 days, the house dust clean within 3 days have a less concentration of SVOC, which suggests maybe you can clean your house twice every week. But I understand it's not easy for working person like me. But nowadays I'm using a robot to clean my house, so it's hopefully it's reduced the SVOC levels in house dust in my house. Thank you very much. And ma'am, what about radon emission is not concerned in context with indoor air quality in Japan, or the levels are below the risk? Yes, I know that radon, but in Japan, we seldom use live in a house with the rocks. So radon issue is quite low in Japan. So I think the concern of the context of the radon is lower or below the guideline levels. And next is regarding indoor microplastic. This is a citizen science project we have just finished. You might find it interesting. Oh, thank you very much, Enda, for great information. I will take a look at your citizen science. So thank you very much for your information. Thank you. Thank you for excellent presentation. I found it truly insightful and informative. I have two brief questions. Since both perceived dampness and specific pollution can contribute to SHS, I was wondering, in the first part of your talk, when discussing the effect of BOCs and SBOCs, did you consider perceived dampness as potential confounding variables? Yes. Yes, we always ask about the dampness, and we adjust with the halving of the dampness or dampness index. Second is perceived dampness linearly correlated with acute indoor relative humidity. If so, do you think indoor relative humidity could be used as a way to adjust or eliminate the confounding effect or perceived dampness in an integrated assessment? Thank you again for your valuable presentation, and thank you very much for your good questions. Actually, relative humidity can associate with increase of dampness, but dampness and relative humidity is not equal. So relative humidity is happen in indoor air, but dampness can be happen in certain place like windows to cause the condensation, or growth, mold growth at the place with the excess wet. So increase of the relative humidity can increase the dampness, but even in a relative humidity is low, you may have a dampness. So I think for your question, you better to consider separately. So I recommend that person not to have a relative humidity high, but at the same time, dampness is not equal. So my recommendation is considering relative humidity and dampness separately. And last is, are there any education materials available for homeowners to raise awareness and advice on how to minimize source levels of pollution and exposure? Yes, we produce a guideline and guideline for not exactly the household, but for the public health officers. So it's unfortunately in Japanese, but we produce the materials or book how we can avoid the air pollutions. So it's not exactly education materials, but we try to educate the house owners, which is a very big topics in ongoing project. So hopefully not only for the public health officers, but we can produce something house owners as well. Thank you very much. I think that's all I can find from the chat box.
Yes, Atsuko, I think that's all from the. Yeah, thank you very much for answering all the questions and your valuable insight into all those questions, and also
thank you.
make it very clear some of the young researchers to understand about the indoor air quality. So I'll request all of the participants to just start our camera, and then we can have one group photo with Atsuko. Then after that, we'll close it.
Yeah, thank you very much. I'm sorry for my English is not my major language, so please excuse me for my poor English, but thank you very much for all the questions. And I know that India's situation could be a little bit different from what we have, but maybe Japan can be your future. So you can take a measure at this moment not to follow what we have experienced before.
Okay. Yes, Ashwin, will you take a photo? Thank you very much to all of you, and thank you. I would like to thank Professor Atsuko for taking his time for to give this talk, and I also thank to all the participants, particularly Professor Enda is also here from University of West of England. Thank you very much for joining, and interesting question and interesting reference material you have shared, and we also have. Shri S.K. Gupta ji is an industrialist and very supportive in our air quality management lecture series since its inception. So see you all in the next air quality management lecture series, and Atsuko, have a good evening to you.
Thank you very much. Namaste.
Namaste.
Namaste. Thank you very much. Bye-bye.
Bye-bye.